Hello, I'm Dr. Mohit Khera, Professor of Urology at Baylor College of Medicine. Today I'll be discussing diagnosis and treatment of erectile dysfunction. How common is erectile dysfunction? Well, if you look at the statistics, roughly 40% of men at 40 will have erectile dysfunction, 50% at 50, 60 at 60, even 70% of men at 70. I tell patients this is a natural part of aging, and the longer you live, the more likely you are to develop erectile dysfunction. What are the common causes for ED? Well, in medical school, we were taught the mnemonic VENT: vascular, endocrine, neurologic, and trauma. The most common cause of erectile dysfunction is vascular, whether there's not enough blood flow coming into the penile tissue or it's coming out too quickly. Numerous drugs can also cause erectile dysfunction, including antihypertensives, such as beta blockers, and antidepressants as well. And we can't discount that many men may develop psychogenic ED, where psychologically they're unable to obtain an erection. So we have to realize that many men who have ED are not being treated. Several studies have found that roughly 75% of men with ED are not being treated. What are some of the potential reasons for not seeking treatment? Many patients are ashamed of their condition. Some patients say that they're concerned that their clinician won't take their symptoms seriously. And finally, many clinicians don't address the issue. If you come to my practice, you will receive a questionnaire called the IIEF, the International Index of Erectile Function. This is a short, abridged version which only has 6 questions. It's extremely useful, because by administering this questionnaire, I'm able to categorize patients into mild, moderate, or severe erectile dysfunction. When patients present with erectile dysfunction, typically in my office, we'll give them the IIEF questionnaire, but we want to look for other sexual dysfunction problems. Do they have premature ejaculation? Do they have Peyronie's disease? Are there any reversible causes of erectile dysfunction? In other words, are they taking an antihypertensive? We also like to examine them carefully and do a detailed physical exam. We check for penile abnormalities and deformities. We look for cardiovascular risk factors. And then we also do laboratory testing as well, checking for a testosterone level, looking for occult diabetes, as well as occult hypercholesterolemia. I want to stress the importance of taking a detailed history when meeting with patients for erectile dysfunction. I divide treatment options into 3 categories: first line, second line, and third line therapies. The majority of patients will use first line therapy, which are oral medications. You may have heard of these: Viagra, Levitra, Cialis, or Stendra. If these are not effective, many men will go on to second line therapies, including urethral suppositories, penile injections, and a vacuum erection device. Eventually, these may not be effective, and many men may go on to either vascular corrective surgery, which is quite rare, but more commonly, men will go on to have a penile implant. It's important to understand the anatomy and the physiology of what's occurring in the penile tissue. Remember that the penis basically has 2 muscles that are running in parallel. In the center are the penile arteries. On the periphery are the penile veins. So as blood comes through the center, it expands the muscle and it compresses the veins against the wall. So the more blood comes in, the less blood can come out. The problem is, as men get older, they develop atrophy of the penile muscle, or they have poor blood flow into the penile arteries, and they're not able to compress the veins. So what's the number one symptom that they'll tell you? They'll say, "Doc, I'm able to obtain the erection, but I can't maintain the erection." What they're trying to tell you is they have venous leak. So treatment options, the most common, as I mentioned earlier, are oral medications. You have several options: Viagra, Levitra, Cialis, and Stendra. It's important to take these medications on an empty stomach at least 1 to 2 hours prior to intercourse. And realize sometimes that if one medication is not effective, you can always try another medication and may have greater success. This is a vacuum erection device, and this is a quite simple device that's used. It's placed on the penis. It's a vacuum. It induces an erection, and then a man places a band at the base of the penis to help keep the blood inside the penile tissue. This is called Muse, which is a urethral suppository, which is placed into the tip of the penis. This suppository then dissolves and allows blood flow to come into the penile tissue. These are penile injections, and they're quite commonly used. It's a small diabetic needle that's placed at the base of the penis, injected at the 2 or 10 o'clock position. The medication is a vasodilator and significantly increases the blood flow into the penile tissue. Typically, if patients choose to use this therapy, they have to undergo a teaching session in the office to make sure that they are using this correctly. And this is the penile implant, which was invented at Baylor College of Medicine in 1973 by Dr. Brantley Scott. It involves 3 pieces, which is the most common. There is a reservoir, which goes behind the pubic bone or under the rectus muscle. There is a pump, which goes into the scrotum, and there are 2 cylinders, which are placed into the penile body. When a man squeezes the pump, water or normal saline comes from the reservoir and fills the cylinders. After engaging in sexual activity, he releases the pump and the water goes back into the reservoir. Patient and partner satisfaction is greater than 90%. These are natural. If a man took off his clothes, you would not be able to tell that he has a penile implant. And again, many patients state that the sensation and the orgasm is the same. It's important to also realize that there's a strong correlation between erectile dysfunction and cardiovascular disease. In fact, a study by Dr. Thompson in 2005 demonstrated that if a man develops erectile dysfunction today, 15% of those men will either have a heart attack or a stroke within 7 years. 15%. What am I trying to say? ED tends to be the first sign of cardiovascular disease. This is based on something called the arterial diameter theory. We know that the penile arteries are the smallest, 1 to 2 millimeters. We know that the coronary arteries are slightly larger at 3 to 4 millimeters. We know that the carotid arteries tend to be a little bit larger at 6 to 7 millimeters. So if a patient is going to occlude his artery, he's more likely to occlude the penile arteries first before he occludes the coronary arteries, and thus many men will have ED before they have signs of a heart attack. How do we link erectile dysfunction and cardiovascular disease? Well, we know the common link is the endothelium, or the lining of the blood vessels. We know that certain conditions, such as diabetes, high cholesterol, smoking, can injure the lining of the blood vessels and thus result in erectile dysfunction and cardiovascular disease. So it's very important to protect the lining of the blood vessels and improve their condition. How can we do this? Well, I call this the 4 pillars, and I take this very seriously with my patients. The 4 pillars of health are diet, exercise, sleep, and stress reduction. Each one independently can have a profound effect on a patient's life. Each one independently can significantly improve a man's quality of erections, and they do help protect the lining of the blood vessels or the endothelium. When patients present to me with erectile dysfunction, how do I evaluate them? It's important to take their vitals and get a BMI. As I mentioned earlier, many men with hypertension or obesity will have erectile dysfunction. We use many validated questionnaires to better assess their erectile function. We do laboratory testing, such as a testosterone value, as I mentioned earlier. There's certain specialized tests that I do in my office as well, better to assess endothelial function using a device called the EndoPat. We do numerous penile ultrasounds in the office. We also use a device called biothesiometry, which assesses nerve function of the penile tissue. I strongly stress lifestyle modification, diet, exercise, stress reduction, and sleep. We do a cardiac risk assessment on these patients to assess if they have occult cardiovascular disease. And men who do have low testosterone and are symptomatic, we do offer testosterone therapy, as it's shown to help with erectile function. Again, we stress the 4 pillars of health. And finally, we do initiate appropriate ED therapy. I just want to give you insight to the future. There are 2 therapies that are now in clinical trials. The first is shock therapy. This is where we deliver low-intensity shock waves to the penile tissue. It's typically 1,500 shocks twice a week for 3 to 6 weeks. What happens is when you deliver these shocks to the penile tissue, it stimulates new blood vessel formation, increases the blood flow, and it increases and improves the endothelial function. Many men who are not responders to Viagra-like medications can become responders. As I mentioned, this is under current investigation. We're currently conducting these trials at Baylor College of Medicine and under a clinical trial. Other therapies that we are conducting at Baylor are the use of stem cells to improve erectile function. Stem cells can improve not only the blood vessels, but it can also improve the nerves and improve the fibrosis which is inside the penile tissue. Currently, we have 2 trials at Baylor. We have just completed our first human trial in men after radical prostatectomy, and many of these men were also diabetic. We are now beginning our second phase trial in using stem cells to treat erectile dysfunction. We also have numerous studies in the laboratory where we are injecting stem cells to better study the dose and the frequency at which we should be using these stem cells to reverse erectile dysfunction. So in summary, erectile dysfunction is more prevalent as men age. Most men with ED are not being treated. Treatment options include oral medications, vacuum erection device, urethral suppositories, penile injections, and a penile implant. ED may be the first sign of heart disease. And finally, lifestyle modifications to treat ED include a healthy diet, exercise, sleep, and stress reduction. Thank you for your attention. I hope you enjoyed this video.